Hello, everyone out there, and thank you for joining and welcome. I'm Keith Palmer. I am a leader at Johnson & Johnson, and I'm head of our ambulatory surgery center business that is on the medtech side of Johnson & Johnson. I am delighted to be here this evening, and more importantly, excited to moderate this important conversation regarding post-traumatic stress disorder, presented by Delta Sigma Theta Sorority Incorporated and Kappa Alpha Psi Fraternity Incorporated. I want to take a moment to congratulate Delta Sigma Theta and Kappa Alpha Psi for hosting such an important event. I think it's important that we take a moment to educate and learn about post-traumatic stress disorder. I'd also be remiss if I did not say I'm a proud member of Phi Beta Sigma Fraternity Incorporated, and I'm grateful for our Divine Nine connection and an opportunity to contribute to such an event. I think it's a powerful conversation that we need to have here today, a conversation on what post-traumatic stress disorder is, how to recognize it, how to manage it, and useful tips and resources you can use and share to drive health and awareness in your and our community, if you will. On a personal note, I was particularly interested in moderating this event because I am a military veteran. I served in the Marine Corps on active duty, and I left the Marine Corps after being wounded, diagnosed with post-traumatic stress disorder. And I can say that I'm here today because of individuals like our panelists, our esteemed panelists, if you will, healthcare professionals and advocates that helped me navigate the journey. And I am now what I believe is a productive member of society. So again, grateful to be here, and we'll hear more from our panelists. Some people like to believe that post-traumatic stress disorder is exclusive to military veterans, and I will tell you that it is not. And I'll allow our panelists to speak more in detail about that. But I want to invite you all to embrace the opportunity to get educated. I also want to invite you all to place questions in the chat during this discussion. Our team members will be interacting with you in the chat and sharing your questions with me so that we can attempt to answer them all. We may not get to them all, but we'll do our best to answer some of your questions. So let's dive in and meet our incredible and esteemed panelists of healthcare leaders and advocates who will help us get educated this evening. And I would like to ask our panelists, I want to do them justice, to share their area of expertise and certainly the work that they do to help improve health in our community. So why don't we go and allow an introduction for each of our panelists. We'll start with panelist one, Kayla Bell Consolver.
Is Kayla Bell Consolver. I am a licensed mental health counselor in the state of Iowa, and I'm the director of our Broad Lodge Drake University Student Counseling Center. I love to be a community advocate for mental health, so I do that through the work that we do in Delta Sigma Theta, as well as mental health content creating on social media, and as well as giving back to the community in as many ways as possible. I would like to say that I am a proud member of Delta Sigma Theta Sorority Incorporated, reigning from the Central Region, and I'm also a member of our Program and Planning Subcommittee, Physical and Mental Health Committee. Thank you for having me today.
You're welcome, Kayla. Thanks for being here, and certainly looking forward to your contributions to the conversation. Next, we'll hear from Shantae Alexander.
Hi, I'm Shantae Alexander, and I am a senior social worker program coordinator for the Memphis City, for the VA Medical Center, and I am a medical professional, but I'm also here as a PTSD person. I am a I am a U.S. Army veteran as well, so I'll be speaking from both sides. Thank you.
Thank you, Shantae, and welcome. Next, we'll hear from panelist three, Charles Duke III.
All right, good evening, everyone. I'm Charles Duke, a member of the Fayetteville, North Carolina alumni chapter of Kappa Alpha Psi Fraternity Incorporated. As a profession, I'm a director of programs in the information technology industry, supporting the Department of Defense and owner of ESO Consulting. As a humble panelist today, I'll be speaking from my perspective and my personal relationship with PTSD. I'm a 20-year retired U.S. Army disabled combat veteran with multiple global combat deployments scaling from 2004 to 2015, experiencing countless life-threatening combat operations, starting at the age of 22 years old. But I wasn't actually diagnosed with PTSD until 2018. So as a result, I've lived nearly all of my adult life managing and navigating the nuances and symptoms of PTSD. I'm truly humbled to be here today to share my perspectives on such an important topic, and I look forward to our conversation. Thank you.
Thank you so much, Charles. So looking forward to hearing more from our panelists. And last, but certainly not least, Dr. Stephen Broughton.
Good evening, everyone. I'm Dr. Stephen Broughton. I'm a proud member of Kappa Alpha Psi Fraternity Incorporated. I am a practicing psychiatrist of over 30 years of experience. I'm currently medical director at the Southeast Arkansas Behavioral Healthcare System Incorporated. It is my pleasure to present to our communities mental health awareness, and post-traumatic stress is one of the most significant disorders that our community deals with on a daily basis. Thank you for joining in with us and learning more about this significant illness.
Thank you so much, Dr. Broughton. And viewers tuning in, as you can see, we have quite the panel and certainly some great perspectives. We're looking forward to hearing from our panelists. And certainly, I want to encourage you all to put your questions in the chat. I'll remind you again, we'll try to get to as many of them as possible to navigate the conversation. But why don't we jump right in and start asking questions to our panelists? I have some prepared questions to drive the conversation. But again, we're certainly not limited to those questions. Want to certainly hear from you, and I encourage you all to participate in the chat. But we'll start with Shante Alexander. And my first question for you, Shante, is what are the main causes and risk factors for developing post-traumatic stress disorder?
Gosh, there's actually so many. If I had to pull some from my personal experience, being somebody who was involved in military sexual trauma, I am a survivor from that. And I think the biggest thing is how you're dealt with immediately afterwards. When you don't have the necessary support and wraparound to provide that safe haven. So with my experience, I was blamed, I was shamed, I was even bullied. And to be honest, I was reprimanded as well. I was reprimanded for underage drinking and was pretty much told that it was my fault and that I was to pretty much deal with the consequences of my behavior for the rest of my life. And to be honest, the company commander was accurate. I spent the rest of my life up until today, including blaming myself for everything pretty much. When it comes down to things that I've done or didn't even do, I take blame for all of it. I find myself apologizing for things that don't belong to me. And so not having that extra support is also a very big contribution to the possibility of developing PTSD. And I think another one is the cultural norms. I think it's important to acknowledge the fact that a lot of cultures, and some of them in our own African American culture, don't understand or acknowledge mental health. And so when it comes down to post-traumatic stress disorder and sometimes the emotional strain that it can cause, I got told a lot that I cried too much, that I am a very emotional person, and that it resulted in me thinking that that was wrong, that something was wrong with me for expressing my emotions. And so I didn't. I thought I was being judged if I did. And so had I had that encouragement to say, it's okay, then maybe when I was having nightmares at night or being triggered for certain things that kind of made me curl up in a ball in a hole, then I would have felt more safe to acknowledge and say, hey, I need help, but when you don't understand it, you can't use what you don't know. And so when you have that support, like I mentioned, 9 times out of 10, you have a lower risk of developing post-traumatic stress disorder.
Thank you so much for sharing, Shante, and thank you for your vulnerability. A follow-up question to that is with this, the things that you've experienced, would that motivate your pursuit in the social work arena?
Absolutely. I mean, so much, there's still so much work that needs to be done. There's still so much knowledge that needs to be put out there, education that needs to be put out there. And I think with that, so many people can have that care. It's being talked about more. And I think people are recognizing it more and actually speaking up more. And I think that if we keep putting the word out, then it will help more people to actually stick up and stand up. And I think social work plays a huge part in that.
Absolutely. Thank you again.
Mhm.
Dr. Broughton, what are some of the unique stressors or trauma experiences faced by individuals from Black and Brown communities, and how do they contribute to PTSD?
Well, that's a very good question. And I tell people all the time, and first of all, I want to acknowledge our veterans here. That's an extreme type of PTSD that they experience through their experiences, which are significantly more stressful than most of us. But the rest of us in the regular society, we have to deal with society as it is. And any traumatic experience, whether you experience it personally or you experience it by word of mouth, can actually stress you to a certain point. I have often stressed that as a person of color, men or women living in the United States of America, where we have had to deal with systemic racism for a number of centuries, we deal with post-traumatic stress basically from birth. When you're taught as a child that you can't look at certain people, or you have to look down, or you're taught as a child not to speak unless you're spoken to, or you're taught as a teenager to make it home safely, you have to be respectful and you have to recognize the fact that you're in danger every time you're in the streets, or you might be killed by the people who have been paid to protect you. It's very significant in the Black and Brown communities, and with that, we have learned post-traumatic stress from the fact that we are taught as children that it's dangerous out there and that there's some harm can come to. So hearing this over and over and over again, it traumatizes us. And a lot of us don't realize that until you start feeling it in certain types of ways. I tell people all the time that if you're in the Black and Brown community and all of a sudden you see blue lights behind you, that's stressful to a number of us because we know what that means. So in terms of the Black and Brown community, it's a proven fact, and it's in the literature and all the studies and all case studies, that Black and Brown communities are significantly more at risk for post-traumatic stress disorder than other communities.
Thank you, Dr. Broughton, and very true. I think we all can relate in the Black and Brown community as it relates to our interaction with law enforcement and the blue lights, or even just the presence of police officers on the highway or in our community. So thank you for sharing. Charles Duke III, would love to engage you, please. What barriers exist within these communities that prevent individuals from seeking help for post-traumatic stress disorder, and how can we overcome them?
Sure, I appreciate the question, Keith. So I'll start with the lack of awareness and education, right? We know that we have, the resources via the internet to seek out and find information on our own. But I'd like to speak more to the awareness and education at our dinner tables. PTSD isn't much of a table talk conversation in our communities, as we all know. So most of our life, values and views and understanding of things that happen in our communities, start at our house, and us as leaders in our homes and in our communities. If we're not educated to know what those symptoms are when they're presenting themselves, how can we, one, be aware within our own selves, but also within our families and our communities? We know we have barriers such as finances, access to services, the impact that it can have on one's career, and even the potentials of over medication. But I really want to focus on two, main topics from my experience, and that is continuously communicating traumatic events through counseling and the continuity of care. Right, it takes a lot of courage for someone to want to open up and express a traumatic event, especially to someone in most cases you've never had a chance to meet before, right? So I've experienced the months waiting to get a visit, the 3 or 4 consultations just to get started. And the question that you're asked is, so what's bothering you today? Knowing that you're on the clock and you really may only have 30 minutes to an hour, going through that process alone is traumatic in itself. So I would simply put that the process to getting the support for PTSD is a barrier in itself. Lastly would be the continuity of care, right? I can remember a time when it was 2 o'clock in the morning and I was, waking up cold sweats, nightmares. All that was available to you is the 24-hour hotline. You call, the person on the other on the line is, they're doing their best to hear you out and understand your pain and where you're coming from. But at the end of the day, that call has to end. Typically, once you start calming down and they tell you someone's going to call you tomorrow. So what do? You wait for that call. And when you get that call, the call starts with, so what's bothering you today? Right. And so, yes, I know it's a balancing act. We have things like HIPAA that kind of stops that continuity of care going across different platforms. But from my personal experience, I found that to be one of the biggest barriers in my life, in my community. Now, in regards to strategies to overcome those barriers, right, it starts with what we're doing today, education campaigns, talking to people in our community who are actually with the people who are seeking out that care, and promoting, mental health literacy, hopefully at the school age. I can remember times when I was a young kid, not knowing that I had PTSD. I could say I went over half my life not really understanding what PTSD really is. And next would be to increase the access of care at the community level. So most people, from my experience, that have PTSD, being in the military, we seek out military groups. So most people want to talk to people and communicate with people who look like them, sound like them, and understand, PTSD from their experience. But on another note, I would say that we have a great experience here with the Panhellenic family, right? We are in communities all over the world. And I truly believe that with the right initiatives and the sponsorships like we're doing today with Johnson & Johnson, I believe that we are strategically positioned for a change in a positive way, Keith. Thank you.
Thank you, Charles. And with this, lack of education that is noted, and would you say that just starting to just have the conversation or at least inquire is a great place to start? Because at times, we're not as forthcoming in the Black and Brown community about some of these things that we struggle with.
Oh, most definitely. That first barrier, just being willing to say I am one, right? And acknowledging that we have PTSD. And even for myself and these other panel members, being comfortable enough and resilient enough to get in this platform and acknowledge that we have PTSD. Hopefully that will break down some of those.
Thank you. Kayla Bell Consolver, want to engage you in the conversation. Thank you so much again for being here. What role does early intervention play in preventing the long-term effects of post-traumatic stress disorder?
Yes, thank you so much for asking me this. When there is a strong emotional and stress response coupled with a traumatic event leading to PTSD, there are various long-term effects such as depression, relational distress, and substance use. But for tonight, I want to highlight the effect of the disassociation, which is a protective strategy the body and brain engage in and is demonstrated through detaching from the immediate stressor, which can be physically, mentally, or even emotionally. And when we dissociate or experience severe stress, it can be even more challenging to recall all of the incidents of the traumatic experience, especially the conclusion of the event, which is where we often feel as though it has been ended. Therefore, individuals may report feeling as though that they are reliving or feeling stuck within that traumatic experience, stating that it never ends, or even report negative core beliefs attached to that experience, such as what Shantae mentioned, where it's all my fault, I'm not safe, I'm powerless, and even I don't have control. Early intervention, whether that be therapy, crisis intervention, or even community healing, which is what Mr. Duke was just talking about, helps to interrupt the ways these traumatic experiences become metabolized and digested into our bodies and our minds. In addition, individuals may experience increased awareness of their inner experiences in ways to cope and respond to these psychological stressors and reestablish a sense of safety and regulation of their nervous system. even when they are in the midst of recalling that traumatic incident. So for example, the same belief of I'm not safe may become I can do things to keep me safe.
Thank you so much, Kayla. I want to stick with you on the panel here for a little bit here. What are some of the effective strategies for reducing stigma around mental health and promoting and help seeking behaviors specifically within these communities?
Absolutely. I think it's imperative for us to begin asking the question, what has happened to you, instead of what is wrong with you? The latter fuels judgment, which someone may already be harboring about themselves, which creates difficulty in seeking help. And the former creates an opportunity for compassion, connection, and even support. One additional strategy is to utilize storytelling, which is so huge of a component within our Black and Brown communities. And we do this through art, poetry, music, and even or passing down our generational wisdom. One of the most powerful things that we can do within our communities related to mental health is to model that it is okay to talk about mental health concerns through open expression within one's own comfort. So not necessarily just saying you should go to therapy, model it by saying, hey, I've talked to someone and it's been helpful. How about you try that yourself?
Thank you again. If we could come back to Shantae, you on the same question, what are some effective strategies for reducing stigma around mental health and promoting and help seeking behaviors specifically within these communities?
That is for me, it's a strong question because I think stigma was one of my biggest barriers. I think the biggest thing for me is piggybacking off of so far everybody is education, but for me it was education when it came down to meeting me where I was, and that means for me normalizing things, using terminology that's relatable. Alongside PTSD, I have other mental health conditions. And when I was diagnosed with other things, for instance, I have, in transparency, I have also been diagnosed with bipolar disorder. And so when I was given that disorder, or that diagnosis, I was like, that's not it. But then my doctor was like, okay, so let's not say that. And so when it was more of a focus on my symptoms, it became more relatable for me to focus on how I was feeling and less on the title. And so I think the education where people can actually understand it, in the community, a lot of people don't understand, the words, the terms, things like that. And so it's scary. And, those terminology, those words can be scary, but, also in platforms like this, platforms where people can feel connected with the speakers to say, hey, that's me up there, hey, I've experienced that as well. So maybe it's not as bad as I thought, maybe it's not, what TV says or what my aunt and uncle said or what my parents said or grandparents, so it just helps normalize what it is to have mental health conditions, or what it feels to be like extra sad instead of, struggling with depression. It could just be that I'm emotional and, get stuck in it sometimes, or, sometimes maybe even bringing the talk of mental health into churches. That's where a lot of places are like, just pray about it, so sometimes you can get stuck in that as well. So I just think seeing people where they are in the community and being able to speak their language will allow people to take the trauma out of the words, the trauma out of the titles, would be a great place to start, because it helped me that way. Even in being myself, it helped me.
Thank you again. And Dr. Broughton, would love your perspective also on what are some of the effective strategies for reducing the stigma?
Well, obviously education and communication. The fact that we're doing something now, the Divine Nine, Kappas and the Deltas tonight, but we're all doing something to let the people know that it's okay to talk about it. If you don't talk about it, then it's hard to address the problem, because this is a problem. And when we say mental problems, it's a problem that doesn't present itself in an acute way unless it's something very traumatic. So the fact that we are talking about it now and allowing people to understand that it's okay to talk about it and there's help when you talk about it allows us to definitely begin to make a difference in how people see these things. the stigma associated with mental health care, particularly in the Black and brown communities, has been significant for a long time. It was okay to be crazy, but they put you in a corner and said they're okay, and that's it. That's all it is to it, and they didn't want to talk about it. The fact that we are now starting to get into treatment and we're talking to people, we're finding out that we had a lot of issues that was hurting us inside, hurting us internally, that are now starting to be addressed, and we're starting to get a healthier viewpoint and lifestyle that we can survive in this country.
Thank you again, Dr. Broughton. Charles, want to come back to you. Oftentimes, post-traumatic stress disorder is associated with military and veterans, as you spoke of, but can you share with us how PTSD shows up in other ways? What are some common misconceptions about PTSD and that need to be addressed?
Sure, Keith. One of them is from my own experience, as I was speaking to earlier about childhood trauma, right? So as a child transitioning from a dual parent household to a single parent household and the experiences leading up to those events, I didn't even realize that I had PTSD as a child, as a young age, well before joining the military. And secondly, I would say one of them is just witnessing trauma. I think that there's a misconception out there that something has to actually happen to you as an individual in order for you to be impacted by PTSD. You being a survivor of it in a certain sense, you understand from the people within our community that just having knowledge of something happening could result in you having PTSD. So I would say that childhood trauma and witnessing traumatic events would be two common misconceptions about PTSD for a non-military or veteran person.
Thank you, Charles. And Kayla, if we could come back to you on the same topic or same question, if you will. Oftentimes PTSD is associated with military veterans. Can you share with us how PTSD shows up in other ways?
Yes, absolutely. I want to highlight, because when we think of PTSD, the specific things that come up are the psychological wounds related to combat, which are very real, such as night terrors, arousal, intrusive thoughts signaled by reminders of combat. But the criteria specifically for PTSD is not only direct exposure to violence, but threatened or perceived violence, serious injury, or sexual violence, which many others listening to this today may relate to. This could also include personally witnessing the event or directly being exposed to it, or even exposed to repeated details of a traumatic event, which is what we call indirect exposure. And unfortunately, many of us, especially Black individuals, may be familiar with that. We think about George Floyd's murder in 2020. But PTSD can show up through avoiding of the reminders of a traumatic experience. Some may avoid specific topics, even in therapy or shows, movies, relationships, or activities related to or that remind them of their traumatic experience, even if others identify those experiences as positive. In addition, it can show up through blaming oneself for the specific incident that happened, increased irritability and mood swings, difficulty sleeping, and constantly feeling on guard or anticipation of something bad happening, not only to you, but of your family. So one misconception is that individuals believe they must forget everything that's happened in order for healing to occur, which tends to discourage individuals from seeking help because they feel that is impossible. I like to add that that is an unfair expectation of yourself as well. In therapy, our goal is not to get you to forget what happened, but rather reduce the stress response that occurs when you experience reminders of the traumatic event and release the burdens that you carry attached to your trauma. Through trauma-focused therapy approaches, individuals often report feeling less overwhelmed and stressed when recalling events related to the incident, and improved ability to cope and respond to their stressors. One additional misconception is that if someone has PTSD, they will always have it. This perspective can significantly impact one's hope in seeking treatment. There are a variety of trauma-informed approaches that can help individuals to reestablish a sense of safety, self-worth, and ability to respond to their stressors. Some examples are cognitive processing therapy, EMDR, internal family systems therapy, somatic-based therapy, and trauma-focused cognitive behavioral therapy, which is developed specifically for children and adolescents. I want to give one last reminder as well. There is nothing wrong with utilizing medication if that is needed as an intervention to support ongoing experiences of PTSD. In our community, we feel like we shouldn't do that. If that is something that you are noticing may benefit you, it is absolutely okay to do that. And you can consult with your psychiatrist, therapist, or even your primary care physician or nurse practitioner about the options available to you.
Thank you so much, Kayla. So much information in your response and such a powerful conversation with all of our panelists here. Coming back to you, Dr. Broughton, you touched on it in your initial response earlier as it relates to PTSD, oftentimes associated with military veterans, but certainly more prevalent or is prevalent in the Black and Brown community. Can you share with us how PTSD shows up in other ways?
Oh, sure. As people will recognize the fact that as we grow up, we have various experiences. All of us have various experiences from childhood on up. And I tell people all the time, those experiences will follow you the rest of your life in some form or fashion. To some, trauma is very significant because they see it, they witness it, they have to deal with it. To others, it's only perceived because of fear. And fear has done a lot in young people, particularly when they're hearing about things that occur in the neighborhood, recognizing the fact that people that they know or grew up with are no longer present because of traumatic experiences. So they're experiencing and dealing with factors that they don't understand, but they hear about those things, and it even comes out in the type of music that our kids are listening to and are growing up with it at this time. Now, I'm in the medical community, and I can tell you that our first responders have to deal with significant things such as the military in terms of what they deal with on a regular basis. I've been a deputy sheriff with the Jefferson County Sheriff's Office in Arkansas for over 15 years. And a lot of people that go around thinking that, well, they just law enforcement officers and this is what they do. It's not normal to see dead bodies from accidents, drownings, and various other types of things. And by seeing those things, you're not immune to the fact that those things are not normal in your life, so you have to deal with them on a regular basis, but you have to move on. In the military, they used to call it combat fatigue, and they put you back out there to get you exposed to the things that you fear the most immediately. Same thing applies basically with our first responders. They have to deal with traffic accidents, shootings, various other things, and those things have to be addressed as quickly as possible. Now, what I would do with some of the deputies that have been exposed to trauma is I'd do a ride along with them for two or three weeks, where I'd ride their shift with them and we just talk the entire time we're riding and they're enforcing the law. But a lot of people don't have those type of advantages in terms of regular civilians. So the mental health center or counselors at school or even going to your church and talking to your pastor or other religious leaders help a great deal if you have things that you are really concerned about that continue to bother you with intrusive thoughts. So the misconception about post-traumatic stress is only for the people that deal with significantly stressful things. That's a big misconception. I tell people all the time, something as simple as a car accident can be very significant in your life. If you're driving down the road and somebody runs a stop sign and T-bones your car from the side, every time you approach an intersection, you're going to slow down and you're going to swerve if a car comes to that intersection because your mind is going to automatically deal with the trauma that you've experienced. So every little thing that happens in your life can significantly affect how you cope with things and deal with things.
Absolutely. Thank you again, Dr. Broughton. I want to remind our viewers and folks that are tuning in to please ask questions in the chat. I don't see any thus far, but I want you to take advantage of this opportunity to hear directly from our panelists and ask your specific questions. I want to be cognizant of our time also, so I'll ask one or two more questions for our panelists and hopefully refer to the chat for more questions for our panelists so you can ask individual and respective questions there. But coming back to Shantae, what are some potential triggers for PTSD and how can individuals manage them? More importantly, how can individuals manage them effectively?
Triggers for PTSD, which is a good question, is that sometimes it can, but doesn't always depend on what the experience trauma is. Sometimes it can be something like loud noises that startle you. Sometimes it can be like being in large crowds and not knowing how to exit big situations. Sometimes it can be a matter of just closeness or being touched in certain ways. I know so for me, I don't like being in closed spaces with men with no ways out. And so in that instance, I might have a door open or people in there with me. And ways to manage those types of triggers. For one, you have to know your triggers. Everybody's triggers look different. Everybody's traumas, are different. And even if they're similar, they might affect you in different ways. And so you have to first know what your triggers are and then know how they affect you. How does it make you feel in your body or just in general with regarding your surroundings, the people you're around, the places you are and the things that you see. How does it make you feel? Like, how does it affect you? And then also, you have to give yourself grace. You can be proactive and just make sure that you are aware of your surroundings, make sure that you see doors, make sure that you know where your exits are, things like that. But also, even in being reactive, just kind of being able to process if you do feel a trigger, if you need to step aside, if you need to take a break, if you need to just kind of sit back and process and just allow yourself some time to breathe, allow yourself some, time to just say, hey, friend, I need you to, come talk to me for a second, or I just need to sit down for a second, and then give yourself grace to know that, you know, for one, I'm okay. And it's okay if I feel like A, B, and C. It's not a judgment on yourself. It's not a judgment on anybody else because sometimes people may not even know that you've been triggered. So you can be proactive, you can be reactive, but at the end of the day, you definitely have to know what your triggers are. And sometimes it's trial and error. Sometimes you don't know what they are until they happen. But you first have to understand your trauma, how it affected you, and the things that ignite those feelings within yourself. And more importantly, get help. Go to counseling and help understand how to help yourself. Everything's not going to be an external factor. So being able to be there for yourself and to show up for yourself is going to be the best thing to do to help manage your own emotions and help manage your own triggers and stressors.
Thank you, Shantae. Help can be perceived in different ways uh, to some of our viewers.
Mm-hmm.
Charles, if you wouldn't mind, what steps can be taken to ensure that mental health services and resources are culturally sensitive and accessible to individuals from Black and Brown communities affected by PTSD?
I think it's what we're doing here today, Keith. It's really just getting the message out at every avenue possible, right? Some people can say that doing this one thing is not enough. Doing this is not enough. Well, if you do that enough, it could be enough. And I think if we engage at that approach, that would probably be our best effort to keep the process going of improving awareness within our communities, Keith.
Thank you. Thank you very much. Same question for you, Kayla. What steps can be taken to ensure that mental health services and resources are culturally sensitive and accessible to individuals?
Yes, thank you, Keith. I want to hit on this from three perspectives. From a public policy standpoint, we need therapists to be reimbursed efficiently and equitably for providing mental health services, especially to Black and Brown communities. It is so disheartening when individuals seeking treatment feel they cannot access them due to cost of services, especially when private pay or private insurance is a primary option received. And these costs are driven due to therapists having trouble receiving equitable reimbursements from insurance companies. Secondly, from a community standpoint, we need more Black and Brown clinicians and organizations that provide mental health services to our communities to be visible and present within the communities, bringing resources and discussions about mental health to us. Trust within the mental health system is essential and something that must be repaired due to the history of harm that Black and Brown communities have experienced when seeking care. They can do this by hosting a workshop, partnering with our local churches and local grassroots organizations, attending community events, and even offering resources and more. By being present and bringing support to the community in culturally appropriate ways, that addresses accessibility and trust that they are reputable services and clinicians here to help you. This is why I've been so proud of the Live Well initiative that Delta has been doing, because this is our main goal. Bring the resources to our community rather than expecting them to find us. Lastly, there are 4% of Black psychologists, 2% of Black psychiatrists, 7% of Black marriage and family therapists, and 11% of Black counselors. Representation is crucial, but there are only so many of us currently. It is imperative for non-Black counselors to continue to receive training and ongoing education of the unique experiences, just like we're doing tonight, of Black and Brown individuals experiencing PTSD, so that our communities will always feel that they can have the most appropriate care, regardless of the identity of clinicians serving them.
Thank you again, Kayla. Dr. Broughton, a response from you from that same question: what steps can be taken to ensure that mental health services and resources are culturally sensitive?
I couldn't have put it better than what you just heard. This webinar that we're doing is so very, very important to our communities. And I just thank Kappa and Delta for leading the way and making sure that our communities are getting the education they need concerning all our health issues, particularly mental health. We have, in Kappa, with our Are You OK initiative, we have made sure that our total wellness has gone addressed on all of our mental, social, physical, and spiritual needs. It's vitally important to have these things addressed in our communities, because the community that we save with educating these people, our people, and dealing with the resources we have, we are making a difference. And I just agree totally with what she said in terms of, if we don't, nobody will.
Absolutely. Thank you to our panelists. And I am going to transition to the chat to see what questions we have from our participants. First one is, are there any mental health resources you can provide for free or at a reduced cost regarding counseling services?
I've been the medical director at a community mental health center for almost 30 years. And I can tell you that there are community mental health centers that have significantly reduced fees or no fees for those that are unable to get the resources they need to get real help in terms of mental health. There are a number of community mental health centers in various different states, but that's where I would start. If you don't have that available to you, you can go to the National Medical Association that gives out a list of all the Black psychiatrists and therapists that are currently available, and we can try to get as many resources available to you as necessary. But there are community mental health centers that do provide resources for indigent people or greatly reduced fees and free counseling services for those that cannot afford them.
And I can add to that as well, which is a great resource. You can also call the public library because they may have a listing of free services available in that community. I also recommend, if there's an agency you're interested in, contacting them to see if they provide a sliding scale, which often is pay what you're able to services, or some even offer pro bono services with clinicians that are either under supervision or associates. Lastly, I want to mention there's a website called Open Path Collective, and they offer reduced price teletherapy options for you as well. But the biggest piece is if you do have a concern, definitely make sure to talk with that organization or talk with the therapist or the mental health clinician that you're working with to see additional options.
Thank you again to our panelists. I saw one comment to remember to check with your employers also regarding resources. Next question is, what types of counseling would you recommend for a person with PTSD?
Yes, I can talk about that one first. EMDR therapy is a phenomenal therapy that has been utilized not only for veterans, but individuals that have experienced a wide range of traumas. Another one is cognitive processing therapy, can be very helpful, it's more structured. You may use internal family systems therapy, somatic-based therapy. Those do engage more within the body. And then last but not least, if you're with a child or adolescent, I recommend trauma-focused cognitive behavioral therapy. However, all the other therapies that I mentioned can also be really useful for them as well.
Anyone else from our panel?
Yes, Keith, this is Charles. I just want to highlight that, if someone is considering, getting counseling and they're seeking out different options, don't stop at the first one. Don't stop at the second one. Continue to try all the various outlets that are out there until you find what works for you. It does exist. Don't lose motivation along that journey, and hopefully you can find someone to travel that road with you. That's all, Keith.
Thank you, Charles.
Another thing is obviously psychotherapy, and as was stated before, there are different types of psychotherapy, which is talk therapy, basically, cognitive therapy, exposure therapy, as stated before. But also, when you get to the point where those are not enough, then a lot of people do have to see a psychiatrist and consider medications, and medication therapy is a significant resource for addressing some of these issues as well.
Thank you again. Shantae, I'm going to direct this one to you to start. How can a daily hostile work environment be handled regarding PTSD?
Well, I know at my job, they offer a lot of training in how to do that. They offer a lot of opportunities to learn how to manage hostile patients, and they allow you to also learn how to handle yourself in that situation. When you have PTSD yourself, you have to be able to recognize how you are able to handle yourself, but then you also have to consider the fact that the people that are around you may or may not have it. And so if you have PTSD and you're in a hostile environment, that might create that as well. I think a lot of it is to be aware of your surroundings, be able to recognize what you're dealing with on the inside, and then also be aware that there might be others around you who are struggling with the same thing. And so ultimately just trying to be just be mindful and to be safe, and then to just consider the fact that everybody's trauma is different, and that you'll just have to be just pretty much being aware of your surroundings. Sometimes it's hard to understand what people are dealing with and what people are going through. So hostility, whether it's in the workplace per the staff or in the workplace per the clientele, sometimes it's random, sometimes it's not, but you just have to be aware. And it's better to be trained in how to deal with it when that comes, because whether it's the clientele, sometimes the clientele, they just don't have experience in how to deal with it. They're just out there. And the staff are the ones really that are responsible for the safety of others, because the clients may not be able to.
Thank you. And panel, this question is represented more than once. So does anyone else want to weigh in regarding a hostile work environment?
I can jump in here.
Thank you.
When you think about a hostile work environment leading to PTSD, again, the pieces of exposure to threatened or perceived violence, especially as Black and Brown individuals. The perception or the experiences of psychological violence, physical violence, unfortunately, even sometimes sexual violence within the workplace can lead to that hypervigilance, can lead to that shame, can lead to the irritability, constantly wondering what people are saying about you, constantly checking to see if you are saying or doing the right things, worried that there might be retaliation towards you, feeling as though you're not able to be within your body, maybe even coming to work and feeling completely distant physically, that dissociation I talked about earlier, within that specific setting, or even depression, anxiety, stressors, all these pieces can be coupled and connected back into what is happening within the work environment. It may be an institutional issue in which you're experiencing that in a variety of different ways. It might be on a person-to-person basis where there's one particular person where you notice that response showing up quite a bit. You might even show up and even having nightmares about going into the workplace, or finding yourself having panic attacks, even thinking about going into the workplace. So when we think about PTSD, like we mentioned, it doesn't only show up in one particular area, but the traumatic and the stressor attached to that is where you might see some of the visceral reactions within your body and your mind showing up.
Thank you again. Charles, I'm going to direct this one to you to start, and then certainly panelists, feel free to weigh in. What advice would you give the support system of someone dealing with PTSD?
The best advice I can give is don't give up on them, right? Understand that person may be going through something that you may not be educated in or ever experienced yourself. So I would say don't give up. And then the second part of that is take the journey of getting yourself educated, right? That'll let that person know as they're going through it that you really are an advocate and that you really are standing side by side with them as they go through it. And if you're able to educate yourself, that could also go back to something we talked about before. That could prevent you from being collateral damage of you yourself becoming have to deal with PTSD because you're able to recognize it early and often. Thanks, Keith.
Thank you, Charles. Any other panelists want to weigh in?
Sure. One of the things that I always tell people who are dealing with anybody who's stressed out by a number of things, as I would tell them if they were dealing with somebody who had significant depression or anxiety and is part of suicide prevention, don't judge, just listen and be helpful and supportive. Be a friend, listen, be supportive and helpful. If you feel that you're getting in over your head, just say, look, I'll go with you. I can't make you go. I can't walk for you, but I'll walk with you. Let's go and talk to somebody about this, because this is more than what I understand how to deal with. But I'll go with you, and I'll be glad to hold your hand or whatever we have to do to get you somewhere where you can address these issues.
Thank you, Dr. Broughton. Let's stay with you on this next question, somewhat related. If I recognize a trigger from someone who suffers from PTSD, how can I reassure them without making a scene in public?
One of the things we have to deal with is the stigma associated with any mental issues. We've been dealing with that stigma for years. And it's only recently become acceptable to even say that something is wrong. So it goes back to just the same thing. Don't judge, just be supportive, listen, be helpful, and help the individual that you think something is going on to at least talk about it, at least talk to you about the possibility of going and getting some help. And you can, I tell people all the time, don't try to diagnose them. That's not your job. Your job as just a friend, family member, or a person that you associate with is to listen, be helpful and supportive, and help them get to the people that can actually help them with the issues they're dealing with.
Absolutely. If I'm able to add on to that too, when we think of PTSD, we're not operating in the part of our brain that logically knows everything is okay in this space. So sometimes we try to talk to people and say, hey, it's going to be all right. Things are going to be all right. You might notice their anxiety and their sense of overwhelm increase. So we actually want to engage in things that really have more rhythm and connection and changing scenery. So if you're in a public space, see if you can go to a different space, because we're not sure in that moment if there's a sound, if there's a person, if there's even a smell that activated their PTSD expressions. So seeing if you can go to a different space, maybe if you're able to walk or move, go outside. If you have different sour candy or things like that, or a peppermint that can help them re-engage within their body to know like what's happened, that can be really helpful. And then just like Dr. Boughton mentioned, just be non-judgmental, right? When you notice them coming back into their bodies.
Absolutely. I'm going to share one more question, and then we'll make some announcements that will provide some additional resources that will help in continuing the journey. But panelists, there's a question in the chat that says, I work with women and children that are impacted by domestic violence. Can you share information on the impact of children having being exposed to or an eyewitness to domestic violence?
I'll say one thing to mention with children is, although they don't have the language to express what's happening, it may show up in more behavioral concerns. This might be soiling or bedwetting. It might be things that we often in our community see as like not having home training and concerns with their behaviors. Disrespect is what we see, because your nervous system is so dysregulated. You're not sure what's happening. Those same beliefs we talked about earlier, those are things children are absorbing. They don't know what to do with it, and they don't have the literacy yet to describe it. So you may see those type of reactions showing up in school, might be happening at home. So if you recognize that happening with your child, one, definitely getting support, and know that children can also experience medication. I know we have stigma around that. Dr. Boughton may be able to speak more to that, but those things can help children to feel safe and secure. I'd also recommend even having certain routines that you can do with them. It may be a nighttime routine that you do. That way there's some form of predictability and safety that is happening. Because when we're thinking about domestic violence, it might be unpredictable. So I'm not sure what's going to happen next. And I'm not sure what's going to happen to me or someone I care about. So having those rituals, having those predictable moments where there's safety and security involved can help them feel as though things can be okay.
That's an excellent answer, and that sums it up quite a bit. Children, they think, they feel differently than we do as adults, and they can have extreme reactions to that type of trauma, and as was noted, bedwetting or behaviors that are not consistent with their age. They might start sucking their thumb again. Some children even traumatized to the point they forget how to talk or aren't able to talk. And they sometimes act out in scary ways, mimicking the behavior that they were afraid of. Getting very clingy with parents or other adults, just don't want to leave their sight at all. It's just a number of things that children react in ways that are not similar to adults that are very telling, and you have to pay attention to those type of triggers and reactions with children.
Thank you again to our panelists, Dr. Broughton and Kayla, and certainly Charles and Shantae. Time can go fast, team. And I will tell you that I know we can continue the conversation. And I know that today's conversation is just a snapshot of the wellness programming of both Delta Sigma Theta and Kappa Alpha Psi. But Kayla, could you please share 1 to 2 upcoming Delta Sigma Theta programs that viewers can tap into to continue their journey to health and wellness?
Yes, absolutely. First, we want to thank the community of our sisters and brothers who have been on this 3-year journey of focused mental health and wellness within Delta Sigma Theta Sorority Incorporated's Physical and Mental Health Committee. The signature campaign is entitled Live Well. We will return on the second Wednesday engagement of September 11th at 8 p.m. Central Time with an exciting lineup of mental health topics that will transform your lives. You can watch this through our Facebook our Facebook Live at Delta Sigma Theta Sorority Incorporated. Our fearless leader, Sora Freeman, has been thrilled to travel across the regions, helping our sisters unpack your stress. We invite you to attend the session in the Midwest region, and Sora Freeman will be joining you at the Eastern Conference. Finally, we are gathering in the Bahamas in October for our Live Well Summit. It is an opportunity to expand our footprint even more, moving from virtual sessions and seminars in our local cities and workshops and conventions and conferences to a weekend of immersion in self-care, healing, and development of an action plan for sustained mental wellness. Remember, Delta wants you to live well.
Thank you, Kayla. And likewise, Dr. Broughton, can you please share what can we benefit from Kappa Alpha Psi?
Well, Kappa Alpha Psi obviously has been the leader in addressing mental health issues for some time now, but we also, under the 35th administration of our Grand Polemarch, Jimmy McMichael, have taken it a step further. We have our REOK objectives to deal with our awareness, of raising awareness with prioritizing personal health care across all dimensions of our lives, mental, social, physical, and spiritual. We want to educate members about the prevalence of health issues like cardiovascular diseases, hypertension, diabetes, obesity, cancer, and mental health conditions as we talk about post-traumatic stress, as well as bullying, and also suicide prevention. We get into data feedback, which is continuously collecting member feedback to inform and shape the program's initiatives and resources. We're tracking progress and measuring the effectiveness of our interventions through our data analysis program. With engagement and promotion, we're developing and engaging in accessible health and wellness content to various platforms on our websites, social media sites, and in-person events. We encourage an open dialogue and discussions about healthcare with the fraternity, but also within our communities and also with our brothers and sisters in the Divine Nine. Action and behavior changes. We are increasing the number of members regularly visiting their primary care physicians for preventive checkups, and we're encouraging mental health screenings as well. We're encouraging members to become the chief medical officer of their own households and serve as an example to motivate your family to prioritize their health and mental health outcomes. We're exploring opportunities to expand the program's reach to other chapters and communities, and we are trying to lead the way worldwide and making sure that our Black and Brown communities are the best they can do with the systemic disparities that we are dealing with. Kappa will always be the leader in that aspect. Thank you.
Thank you, Dr. Broughton. Those are wonderful programs to share. On part of J&J, I also encourage everyone to visit the Johnson & Johnson My Health Can't Wait website at myhealthcan'twait.com. My Health Can't Wait is a community wellness and initiative of in-person events and online resources addressing several medical conditions that disproportionately affect people of color, with resources such as Talk That Talk, prostate cancer resource for Black men, That's My Word, multiple myeloma cancer resource for Black men and women, Save Legs, Change Lives, a resource for peripheral artery disease, Depression Looks Like Me, depression resources created for and by the LGBTQ plus community. Research Includes Me, a resource that increases Black and Brown participation in clinical trials. And myhealthcan'twait.com is again at www.myhealthcan'twait.com. Each of these programs and others on the My Health Can't Wait site provide culturally appropriate education on risk factors, what and how to talk about with your doctor, how to process diagnosis emotionally. The more resources we can provide to the community, the better we are collectively. I want to take this opportunity to thank Johnson & Johnson, Kappa Alpha Psi Fraternity Incorporated, and Delta Sigma Theta Sorority Incorporated for your commitment to health, equity, and wellness. Looking ahead, stay tuned for the next episode in the partner series. We will dive deeper into issues at the forefront of patient care within the Black and Brown community. Again, thank you again. Have a great evening, everyone. Before you part, please stay tuned for a video, and then we'll close. I know we went over just a few minutes, but I think it was a worthy conversation. Take care, everyone.
Informed, involved, invested. The 35th administration of Kappa Alpha Psi Fraternity Incorporated.
My brothers of Kappa Alpha Psi Fraternity Incorporated, I want us to start this message by asking, are you okay? In fact, I encourage all of us to take time each week to ask this very question of ourselves and the brothers that we come in contact with. Are you okay? In the United States, while Black Americans experience similar rates of mental illness as other Americans, there are some contextual differences. According to the National Alliance on Mental Illness, 1 in 5 U.S. adults experience mental health each year. And 50% of all lifetime mental illness begins by age 14 and 75% by age 24. When we look at the data for our community, only 26.4% of Black and Hispanic men ages 18 to 44 who experience daily feelings of anxiety or depression were likely to have used mental health services. And that's according to the American Psychological Association. Furthermore, only 1 in 3 African American adults with mental illness receives treatment. Think about that, 1 in 3. Neither is numbers and prompted a more profound discussion within our fraternity. Due to our membership's recent health and wellness survey results and the unfortunate loss of some of our members, we're launching a national discussion around mental health awareness and resources. In service of our fraternity's fundamental purpose, achievement in every field of human endeavor, we want to prioritize mental health and promote mental health awareness and resources within our fraternity. I have the distinct honor of announcing the launch of our 2024 Mental Health and Awareness Initiative, Are You Okay?, in partnership with Johnson & Johnson Innovative Medicine. As we embark on our Province Council sessions, we invite our members to join us on this mission to address mental health in our community. We'll partner with leaders in each province to ensure that we have mental health resources available to spark a dialogue around our unique challenges and how to overcome them together. Our goals are to increase awareness, create a safe space to discuss where we are in our mental health journey, provide local resources for mental health assessments and appropriate treatments, encourage necessary action, address stigmas around mental health discussions within our family and communities, and indeed be our brother's keeper. We recognize that mental health is different and many factors complicate our path. Through this national initiative, we challenge ourselves to come together as a fraternity across nearly 700 chapters and 400 plus communities across the continental United States and in 13 overseas territories. We invite you all to join me in asking, are you okay?